Welcome to This Explainer. Today, we're going to break down a topic that is absolutely crucial for our personal health and awareness. Look, we all experience everyday aches and pains in our mouths, right? I mean, who hasn't burned the roof of their mouth on a hot slice of pizza or accidentally bitten their own cheek? But here's the real question. Exactly when does that unexplained mouth and throat discomfort actually warrant an immediate trip to the doctor? Well, today we are decoding the early signs of oral cancer based on expert medical insights, and we're translating those crucial symptoms into a super clear guide just for you. We're going to look at exactly what to watch out for, how long you should wait, and what specific tests you need to ask for when you do see a professional. So let's dive right into this by asking the most critical question on every patient's mind. When should we ring the alarm bell? We've literally all been there. You're chewing something, maybe talking a bit too fast, and suddenly, chump, you bite your tongue or the inside of your cheek. It hurts, it's annoying, but normally, you forget about it in a few days. The line between a normal, temporary mouth issue and a potentially dangerous symptom can honestly feel pretty blurry. But the medical community actually has very specific guidelines to help us tell the difference, and it relies heavily on paying close attention to healing times and hidden pains. Let's kick things off with Section 1, the 3-week healing rule. We'll be differentiating harmless injuries from non-healing wounds. Okay, so picture this. You've got a cut on your tongue. Naturally, you just assume, oh, I must have accidentally bitten it with my teeth. And hey, that is a perfectly normal assumption to make. Our mouths go through a ton of wear and tear, whether from accidental bites or scraping your gum with a really sharp potato chip. But the warning sign flashes when that wound on the tongue, or perhaps a sore inside the gums, simply refuses to heal. That initial assumption that it was just a bite might be entirely separate from what is actually going on. It's the persistence of the wound that changes the story from a harmless accident to a potential danger. And the magic number you need to remember here is 3. 3 weeks. If a cut, a sore, or a wound on your tongue or inside your gums has not completely healed up after 3 weeks, you have got to stop waiting. It really doesn't matter if you initially thought it was just a bite. The failure to heal within the specific 3-week time frame is quite literally your body's alarm bell ringing. This is the exact moment when you need to transition from waiting it out to actively visiting a doctor for a professional evaluation. Moving right along to Section 2, hidden aches and pains. We're going to investigate deep discomfort and unseen signs. Now, what about the stuff you can't see? There are 3 classic hidden symptoms you really need to monitor beneath the surface. First up, persistent, unexplained tooth pain that just won't go away. We aren't talking about a mild, fleeting ache here. We're talking about pain that really lingers. Second, pay super close attention if that pain feels like it's localized deep down within the root of the tooth, like way deep inside the jaw area where you can't even see it. And third, the presence of pus without any clear, obvious cause. If you are experiencing this kind of deep root pain or unexplained pus, this is absolutely not something to just tough out. You should immediately consult a medical professional because these hidden signs suggest something is happening beneath the gum line that needs to be brought to light. Which brings us to Section 3, beyond the mouth. Let's look at tracking symptoms in the nose and throat. So imagine on day 1, your nose gets completely blocked, or your voice suddenly becomes rough and hoarse. We all get colds, right? But what happens when you hit the 1-week mark? If your nose remains stubbornly blocked and absolutely refuses to open, or if your throat stays hoarse and irritated for up to a full week with zero improvement, these are vital signs to take very seriously. A cold usually begins to clear up, so persistence is the key word here. A full week of an inexplicably blocked nose or a hoarse voice means it is definitely time to get checked out by a doctor. All right, on to Section 4, getting the right test. Let's talk about navigating diagnostic blind spots. This next part is perhaps the most empowering piece of knowledge you can take to your doctor's office. You might go in complaining of that deep root pain and pus we just talked about, and they order a standard x-ray. But here is the catch. That standard x-ray might show absolutely nothing. Zip. Zero. Everything might look totally clear to the doctor, leaving everyone completely baffled as to why you're in so much pain. That is a massive diagnostic blind spot. If a standard x-ray fails to reveal the problem, a contrast CT scan is the definitive test you actually need. Why? Because if there is swelling hidden deep down that is actually being caused by cancer, the contrast in the CT scan will definitively reveal it, even when the x-ray missed it completely. Okay, let's quickly summarize these actionable takeaways so you know exactly which timelines mean you need an urgent doctor's visit. For tongue or gum wounds, your threshold is 3 weeks of non-healing. For a hoarse throat, if it lasts up to 1 week, you make the call. Got a blocked nose? If it stubbornly persists and refuses to open, it's time to go in. And for deep root pain or the presence of pus, if it is persistent and unexplained, do not wait. Have it looked at immediately. These are your personal alarm bells, folks. To wrap up this explainer, I really want to leave you with this final, absolutely vital question to think about. If your symptoms persist, will you know to ask your doctor for a contrast CT scan? We've seen that standard tests like x-rays can sometimes miss the hidden dangers causing your pain or swelling. Being an informed patient means knowing not just when to go to the doctor, but knowing exactly what to ask for when you get there. You are now equipped with the timelines, the symptoms, and the precise medical tests needed to advocate for your own health. So stay vigilant, listen to your body's alarm bells, and never be afraid to ask for the right scan. Thank you.